then.
Carol, thank you very much. At least we will be prepared. And that high pollen count will come as no surprise to people who are allergic to it.
Yeah, on Sunday, the Hayfever advice section of the NHS website was accessed once every 3 seconds. It shows how many people are struggling right now, doesn't it?
Yeah, in fact, around a quarter of adults in the UK. So let's get some advice now on how to control the symptoms if you're struggling. GP Dr. Helen Wall is here with us. It is, as Carol just said, it is peak time for hay fever problems. Is this something that people go to their doctor about, or do they just try and manage it themselves?
It feels like it's changed a little bit over time. So certainly we definitely used to see lots of people with hay fever, but it is something that can be managed with the advice from, as we said, the NHS website or your local pharmacist. It's just perfect for them to discuss with you and manage, because most of what is available without prescription. There's very few items that we can give for hay fever that need a prescription.
And it's so tough, isn't it? Because, you know, it'll look like this outside. It's glorious. You want to be out in nature and you find that you just can't be. So staying inside isn't really an option, is it? No. What can you be doing?
Well, that's the first thing if you look on the website, is to avoid the pollen, which, as you said, is not realistic in these summer days. The next thing is to look at your symptoms, because the baseline treatment that we would suggest is an antihistamine. So hay fever is inflammation in the nose, but the nose and throat is connected. So you get itchy throat, sneezy, blocked nose, eyes, streaming eyes. So there's different steps to the treatment. So if an antihistamine isn't working for you, you can progress onto a nasal steroid spray. And some people get a bit twitched when we say steroid because of all the connotations that come with that. But the nasal steroid spray, the ones that are available commonly, don't generally get absorbed into your system. So they don't come with all those side effects that normal sort of oral steroids would. And if you use them properly, they have been shown to be really, really effective. The problem is a lot of people don't use them properly, and by that I mean they tend to get the spray and they tend to direct it into the middle of the nose. The advice is to do it into the outside of the nose with the opposite hand on both sides, and not to do that sniff up straight away.
Say that again. Go on.
So get the spray.
Yeah.
Put it in your nose towards the outer aspect, not the inner aspect.
Yeah.
And do that on each side with your opposite hand. And when you do it, the first thing you always want to do is sniff up. You just basically remove it from where it needs to sit to work. So just let it sit, take some swallows, you know, rather than sniffing it, and that will help it sit where it needs to be and work.
That's really interesting, because I always assumed it was about inhaling it and it easing your airways. This is about it sitting in your nose itself.
It's the mucosa of the nose where you need it to be, and even a step before that, if you look on the advice, is maybe even doing some saline washes in the nose can actually remove the pollen that's trapped in there. And pollen's a really sort of insidious thing. It can end up on clothes, it can end up on persons. So the advice is, if you are out all day in the pollen count, you're coming home, especially if you've had to work outdoors, strip off, get changed, have a shower, leave it outside. Try and avoid drying your washing outside if you're very badly affected, because even that can cling to it. And then the advice is, if you are indoors, you know, keep your windows shut in the car if you're travelling about.
And when it comes to medications and deciding what medications to take, a lot of it depends on, you know, your other types of health problems that you might have already. Yeah. Because I guess the entry level that you're suggesting is an antihistamine, but start with a non-drowsy.
Yes,
and that's
definitely.
Like the baseline, basically.
Start with a non-drowsy, because when I talk to patients, they'll often say, well, I don't get drowsy anyway with that. But there have been studies to show that even if you don't feel drowsy, your reaction times are slowed. So if you're driving, if you're working, things like doing exams for teenagers, because 15% of teenagers are affected by hay fever. There's been evidence to show that they can even drop grades in their exams with sedating antihistamines, even if they don't feel tired. So try and stay away from the sedating antihistamines. Stick to the normal ones. The ones you can buy in the shops are perfectly fine. It's exactly what you would get on prescription. People often say, well, they're just cheap, but they are cheap. So, you know, get them from the supermarket, get them from your local store. It's exactly the same. Don't be put off because they're cheap.
So you don't have to spend a lot of money?
You don't have to spend a lot of money.
Brand name ones?
Not at all. The brand names are often exactly the same as just the individual drug name ones.
Really useful. Thank you.
Helen, thank you. Now, we're staying on health.